When a loved one needs care at home, the terminology alone can be overwhelming. What's the difference between home health services and private duty nursing? Is an in home health aide the same as a caregiver? Today, we're cutting through the confusion to help you find exactly the right care for your situation. Hi, I'm Jasmine, registered nurse, CEO, and founder of Navi Nurses. After years of helping families navigate the complex world of home care, I've seen firsthand how confusing these terms can be. Medicare certified home health services, also referred to as home health care, might sound like they cover all of your home care needs, but they're actually quite specific, providing intermittent, skilled care for homebound individuals recovering from acute conditions. So, option number one is Medicare certified home health care that is typically covered by your insurance carrier, as well as Medicare. What exactly is it? This is intermittent skilled medical care that's prescribed by a physician. It must meet Medicare's homebound and skilled need criteria. Typically, these services are time limited and they're aimed at recovery or stabilization and can happen in 1, 2, or 3 visits a week for anywhere from 2 to 8 weeks. Typically, these services provided include skilled nursing for things like wound care, IV antibiotics, injections, and it can also include physical therapy, occupational therapy, and speech therapy as well. Medical social services are also available for resource coordination. These services are covered 100% by Medicare Part A for qualifying patients, and they should be covered thoroughly by your insurance carrier. They do require physician certification and a face to face visit. Please understand that these services are not long term and they do not provide continuous care. They're best suited for people who are able to manage pretty independently at home right after post hospitalization, perhaps after surgery, or maybe even a fall. Your second option is private duty home health or private duty nursing. What exactly is this? This is continuous with extended hour skilled nursing care that's available for you. It allows for customized care without Medicare's restrictive criteria, and it can be scheduled anywhere from 1 hour of care to 24/7 care. This care typically focuses on complex medical and nursing management, along with clinical oversight from your pre existing medical team. And the services that are provided are exactly what you're looking for and what you need. From a nursing perspective, it can include complex medication management, ventilator and tracheostomy care, feeding tube maintenance and providing the enteral nutrition, wound care and dressing changes, chronic disease monitoring and management, as well as support with aging and aging in place. Please check with your long term care insurance if you do have a policy in place, because oftentimes they do cover portions of this care. Private pay nursing is ideal for people who are experiencing medically complex conditions requiring regular skilled assessment and are at risk for perhaps another readmission or declining any further. This is also wonderful for people who are ventilator dependent or have just experienced a hospitalization and are transitioning, needing more intensive monitoring. Families seeking medical oversight beyond what home health aides can provide will find that private duty nursing is an amazing opportunity for them to find the peace of mind that they're looking for. And your third option are home health aid services, or just like caregiving services. What this includes is personal care assistance with activities of daily living. So, getting up, taking a shower, getting dressed, and making sure you're eating and taking your medications. Typically, these services are non medical, non nursing support with some basic health monitoring at best, but not all can include health monitoring. You'll want to talk to specific providers to learn more. These shifts are oftentimes scheduled in hourly increments of 4 hours to 12 hours, and they help with the basic activities of daily living, like bathing, grooming, and dressing assistance. They'll also be supportive and helpful with toileting and continence care and can provide support with transferring and mobility, as well as meal preparation in the home and feeding assistance. Oftentimes, these in home health aides and caregiving companies can provide light housekeeping related to personal care and they typically cost anywhere from $25 to $40 per hour on average. These services, again, are generally not covered by Medicare or insurance, except in limited circumstances. Medicaid may cover these services for income eligible individuals. These in home health aides and caregivers are ideal for people who are requiring help with routine activities, but not for skilled nursing. They cannot administer medications or provide recommendations for care or medication changes. These services are also wonderful for families who are seeking additional respite support for themselves. When you're trying to make the decision about what choice is going to be right for you, there are a few key considerations you're going to want to pay attention to. The first is just medical needs assessment. If you or your loved one requires skilled nursing care, this is something important you're going to want to pay attention to. Along with that, is there complexity to medication? Are you taking multiple medications, especially cardiac medications? Is there wound care needs? And do you need support with wound care multiple times a day? Another assessment that's really critical is understanding what you or your loved one need from a personal care perspective. Is assistance with bathing, dressing, general mobility, and toileting something that you need support with? What about meal preparation and feeding assistance? Most families are surprised to learn that these services are time limited and they focus primarily on medical recovery rather than ongoing support. Private duty home health provides continuous skilled nursing care that goes well beyond what Medicare or traditional insurance certified services offer. While many people confuse home health care, private duty nursing, and personal care assistance, each serves a distinct purpose in the care continuum. An in home health aide provides hands on personal care that's crucial for daily living, but doesn't typically include the medical or nursing services that nurses provide. Though their title includes health, their focus is primarily on assisting with activities of daily living rather than medical or nursing interventions, making them a more affordable but less clinically focused option than private duty nursing. Finding the right care means matching services to your specific needs. Many families benefit from combining services, perhaps using insurance or Medicare covered home health services for skilled needs, while also adding private duty home health nursing or an in home health aide for consistent support with daily activities. Home care options can seem complicated, but understanding the distinctions between home health services, private duty nursing, and personal care assistance is the first step towards creating a comprehensive care plan. If you're in the Phoenix, Scottsdale, or surrounding areas, please contact Navi Nurses today to learn how we can help you navigate these options and design a tailored plan that meets you and your family's unique needs. If you're finding this video helpful, please subscribe to our channel for more insights on at-home healthcare and personalized care options.